So what I want to talk about is two areas of focus. So certainly want to talk to you about some of the virtual infrastructure we have put in place. And as we know, this isn't about bricks and mortars. This is about really a new philosophy of care, of how we deliver care. And I think for providers, it's about learning to do with patients, not to or not for patients. So it really is a shift for providers as much as it is for patients, to bring patients as an equal partner to the table. The second is readying for the future. So we know the ministry certainly signaled when we started that this was a 2-year project in terms of funding. So we are at the end of our funding year. So how do we actually then create a case for building a sustainable change? So as far as the virtual infrastructure is concerned, the very first was our business plan. And that really provided everything that we needed in terms of the framework, the QI framework that we've built, but also identifying a lot of the issues as well as the projects that we would be going after. The second piece is our terms of reference. So the terms of reference is really our guiding principles of how we're going to work together. What are the roles, responsibilities, and accountabilities for each of the partners? And this is the biggest thing about the Health Links is we know this is a voluntary initiative. So it's really about building that trust, that engagement, and that commitment. And I would say for the Huron Perth Health Link, I would say that our partners have been committed and engaged. I just want to talk about just a few things around our guiding principles. And the first is patient-centered or person-centered. So we've been talking for years about being person-centered or patient-centered, but what does that really mean? And as I alluded to earlier, it's really about bringing the patient as an equal partner. The second thing I want to talk about is sustainability. Right from the beginning of developing our business plan, we started talking about how do we ensure that this is sustainable. So this is really about now the partners really keeping this alive. And then blame-free. So in any major change initiative, there's a lot of angst. And when there's a lot of angst, it's much easier to blame that person over there for what we're into today. So we've really allowed people, hopefully, to call that out, that this is about, okay, yeah, there's an issue here, but what are we going to do to move forward? The second part of our virtual infrastructure is our steering committee. So our steering committee is made up of each of the major sectors, and it continues to grow as we identify other sectors such as housing and EMS, who are now sitting at our table. And it's their responsibility to bring the message of Health Links and the work that we're doing to their various sectors. So our long-term care rep, she is responsible for making sure that all of the long-term care facilities in Huron Perth are aware of what's going on. And the second is our project resources. So you'll hear from our project manager, Lisa Marlin van der Wal. We also have a project coordinator. But I also call out that it's the commitment of the partners who have participated in the working groups, who are very much the project resources, and who at the end of the day are going to be delivering on the Health Links mandate. Kelly alluded to it being a quality improvement initiative. So our whole framework and our whole business plan was built on a quality improvement framework. But I just want to talk about 3 of the foundation enablers. One is human resources. So the ministry certainly signaled that the money for the Health Links was not for frontline. So this was really about how do we build capacity within our current resource base. The second is a cultural change. So this really is a huge culture shift. And so how, in order to really sustain the work of the Health Links, we all have to be involved in how do we change how we work with patients and how we work with one another, breaking down those silos. And then, of course, enabling technologies. So we know with the CSWO, the Connecting Southwestern Ontario e-health program, and certainly some of the other e-enablers, such as the coordinated care planning tool, which is on its way to be an electronic tool. Our Health Link is one of the early adopters for that. So it's going to be that instant communication where right now we're faxing coordinated care plans. They're paper-based, and it is cumbersome, and we know that. So hopefully, when we can really bring technology into allowing instant communication, instant alerts, and instant updates, then I think we'll have made the case for really moving some of this work forward. These are some of our project working groups. I'm not, the list is there, and if you want any information about what each one of them do, that's, we can certainly provide that. But I think the big thing is that the work of each one of these is really to support the coordinated care planning working group. And that's really the heart of the Health Links. And so we have two sub-project working groups out of that, and that is the IDEAS team, which you are going to hear about the great work they have done. And then building a patient navigation framework. So we really believe that patient navigation is a dynamic partnership with our patients and based on their, where they are in their journey. And I'm not going to steal the thunder for the IDEAS program, but some of the early work is definitely starting to show some promise in terms of implementing a coordinated care plan with a patient and decreased utilization of hospital and ER. And then, and then finally, building for the future. So we have just launched a very ambitious sustainability plan, which is really aimed two-pronged. The first is building leadership capacity to really help support. So for the next 6 to 8 months, a number of our leaders around the table, including physician leaders, are taking part in a leadership program, which is, we're asking them to give up anywhere from 4 to 6 hours a month. And from there will be a frontline teams, which will really take that work and really develop those leadership champions at the front line to really help sustain this work. So it's about building the capacity for change within our leaders and within our front line. And that's our journey in a very short.